Home Quarantine Care Guidelines for COVID-19. As cases of COVID-19 increase, what should individuals be mindful of if they are suspected to be sick or have mild symptoms? What should be done if individuals are in home quarantine, waiting for COVID-19 testing or pending results? What should caregivers or family members be mindful of to prevent infection or disease transmission? This video will provide some guidelines. Please be aware that suspected cases or patients with confirmed COVID-19 who have trouble breathing or a change in mental state should seek medical help immediately. Spatial living arrangements. If possible, place the quarantiner in a well-ventilated single room with windows kept open. No visitors should be allowed. The quarantiner should wear a surgical mask as far as possible. Other household members should stay in a different room. If a separate room is not available, do not share the same bed with the quarantiner and try to keep a distance of at least 1 meter or as much as possible. Limit the use of shared spaces, such as the kitchen or the bathroom, by the quarantiner and ensure these spaces are well ventilated. Care arrangements. Designate a vaccinated household member without chronic illness to be the main caregiver. When the caregiver is in the same room with the quarantiner, they should wear a surgical mask that covers the nose and mouth completely. Avoid touching the mask during or after use. If the mask gets wet or dirty from secretions, replace it immediately. Dispose of the mask properly after use. Wash your hands frequently with water and soap for at least 20 seconds and dry your hands with disposable paper towels, especially after coming into contact with a quarantiner or their surroundings. Also, wash your hands before and after meal preparation, before meals, and after using the toilet. Avoid direct contact with body fluids, including oral or respiratory secretions and stool. Use disposable gloves and a mask when providing oral or respiratory care or handling stool, urine, or other excreta. Wash your hands before putting on gloves and the mask and after removing them, and dispose of the waste in a dedicated rubbish bin with a cover. Avoid dining together or sharing tableware, toothpaste, toothbrushes, towels, or bed linen with the quarantiner. Cleaning directions. Use 1 to 49 diluted bleach solution to clean the household environment, bathrooms, toilets, and the frequently touched surfaces daily. Wash the bathroom and toilet after use by the quarantiner. Pour diluted bleach solution into the toilet before flushing. Use regular laundry soap or detergent to wash the tableware, clothes, towels, and bed linen of the quarantiner. If conditions allow, machine wash at 60 degrees Celsius or above and dry thoroughly. Monitoring of household members. As all household members of the quarantiner are considered high-risk individuals, they should monitor their own body temperature and health status daily. If a household member develops the following symptoms: fever, sore throat, diarrhea, cough, loss of taste or smell, they should report to the health authorities and seek medical help and COVID-19 testing as appropriate. They should wear a surgical mask and avoid public transportation if possible. These guidelines are published jointly by experts from GX Foundation and CCOUC, the Collaborating Center for Oxford University and CUHK for Disaster and Medical Humanitarian Response. Animation by Gaji Creative and Tech.